Self-assessment. My resting stage after 5 minutes started with my respiratory breath of 16 breaths per minute. My breaths per minute fell into the normal average adult range. My respiratory breaths felt calm and rhythmic with no stress symptoms alerting my parasympathetic nervous system. Inhalation and exhalation seemed invisible until I was conscious of counting my breaths. After exercise, my respiratory system increased the need for more oxygen inhalation and carbon dioxide exhalation, with the increased breaths per minute at 21. The brain's neurotransmitters inhibited the parasympathetic nervous system to react to the increased demands for increasing the oxygen supply to the lungs, cardiovascular vasodilation, that increased my heart rate to 117 beats per minute during the aerobic jogging and 110 beats per minute during the anaerobic push-up phase. The mean average during aerobic jogging of 117 fell in my age recommended level, with a 70% mean average used. However, the vigorous anaerobic push-up using the ATP PC storage fell under the recommended average of 121 to 147 beats per minute. During jogging, my breath increased, heart rate increased with more rapid, deep felt pounding. My muscles felt warmer than resting. During the second push-up stage, I started off really good. My breaths was normal. I felt a slight increase in heart rate, but no deep pounding like jogging. Afterwards, jogging in place made my muscles warmed up and ready to go and to perform my daily activities with speed. However, after I performed the push-ups, I felt like my muscles has been taken to their maximum and needed rest. I believe since I stopped early from having a tricep muscle spasm at around 2 minutes and 32 seconds that my heart rate and breaths could have been different. Also, fatigue was setting in since I do not do sit-ups very much. As I slowed down at 1 minute and 20 seconds, I started to decrease my heart rate during the slower push-ups until I stopped at the 2 minute 32 second mark with 21 breaths per minute. At the final fatigue after the push-ups, my right arm locked up from the muscle spasms. I felt stiff and sore in both arms since I wasn't accustomed to it. 3 chronic adaptations. First adaptation that exercise provides is the importance of increased lung capacity volume that will increase pulmonary ventilation in the respiratory system by decreasing the alveolar partial pressure, or POA, which enhances the oxygen-gas exchange, thus improving the cardiovascular system's blood flow, in return a faster recovery process with the neuromuscular system responses. Additional lung capacity volume will also help decrease respiratory diseases. Secondly, decreasing the heart rate during long-term exercise program will improve the respiratory system's pulmonary circulation system, thus increasing the blood flow, decreasing blood pressure, and decreasing hypertension within the cardiovascular system. The neuromuscular system, through a decreased heart rate, will improve the return of homeostasis back into the sympathetic and parasympathetic responses, thus improving the neurotransmitter, the delivery of nutrients to the muscles for performance. Lastly, long-term exercise will strengthen muscles, allowing the neuromuscular system to improve the range of motion through the increasing of motor units' firing potential, thus reducing neuromuscular fatigability, resulting in fatigue that causes a decline in health. The effects of fatigability towards the respiratory inhalation and exhalation gas exchange also affect the cardiovascular system. The cardiovascular system needs oxygen and carbon dioxide gases to increase the volume, then maximizing the cardiac output to provide more ATP energy sources for daily activities and reduction of cardiovascular diseases like stroke. Stress can play a factor. It is reported that with stress and the use of exercise compared to stress and no exercise, that there was a decrease in systolic blood pressure by P less than 0.05. Thus, exercise helps to maintain the vasoconstriction and vasodilation within the cardiovascular system by aiding the homeostasis return.